And listen to this senior doctor from a hospital in the town.
We are in full emergency with this coronavirus pandemic. Our health personnel, nurses and physicians are working round the clock, countless hours to fight this incredible situation. We do not know how long this pandemic will last. I have two messages. The first one is for the general population. Please stay at home. The second message is for whoever wants to help us. We are in desperate need of both nurses and physicians, together with ventilators and dispositives for protection.
And I'm afraid another grim warning from a nurse working at a hospital, this time in Milan. This is her assessment.
We are all working in a state of very high stress and tension. Psychological tension has gone through the roof. Unfortunately, we can't contain the situation in Lombardy. There's a high level of contagion, and we're not even counting the dead anymore.
Well, Italy's been under severe nationwide lockdown for 10 days now. The Prime Minister, Giuseppe Conte, has warned that life won't immediately return to normal when the worst is over. Here's Mark Lowen in Rome.
Italy's lockdown is the model being adopted elsewhere. Public transport and traffic are still running, but people are only going out in urgent need. And it's orderly, with measured queues for the supermarket as people are allowed in one by one. The fruit and vegetables are stocked as normal. There's very little sense of panic buying here. And with the loo rolls, well, some brands are down, but with this level of outbreak, Italians are behaving, on the whole, rationally.
Well, let's take a look now at the rest of Europe. The EU chief Brexit negotiator, Michel Barnier, has tested positive for coronavirus. He posted this on Twitter.
Hello, and thank you for paying attention to this very personal and exceptional message. In this very deep coronavirus crisis that is touching the whole world and Europe in particular, I want to tell you that I have tested positive for COVID-19.
So face-to-face talks on the future relationship between the UK and the EU after Brexit have all but stopped. Some of Mr Barnier's team members are also now in isolation. Across Belgium, there are nearly 1,800 cases and tough lockdown measures are being enforced. Here's Gavin Lee, who's in Brussels.
There are police patrols on the streets. It seems to be largely being observed today, but there have been instances in parks in Brussels where people have congregated in big numbers, either playing football or having a picnic, and it's been dispersed by the police. And the warning from the Interior Ministry here in Belgium is that you'll get two warnings. First of all, you'll get the initial warning, and if you're seen again, there's a €4,000 fine or a 3-month prison sentence. And the Interior Ministry is saying you should call the police if you see groups of people out of the house.
In Monaco, Prince Albert has tested positive for the virus and is now working from home. Meanwhile, the pandemic is causing a huge amount of stress on everyone right around the world. People are exhausted. This was the Dutch Parliament on Wednesday. And just keep an eye on the top of the picture here. The Minister for Medical Care fainted at his lectern. 56-year-old says he was exhausted from weeks of intense work on coronavirus. More than 2,000 people in the Netherlands are infected. Right, let's move from Brussels and head to Germany, where the death rate from coronavirus is much lower than in other countries. And there are more than 14,000 cases nationwide. The BBC's Jenny Hill has some of the answers from Berlin.
There are a number of theories as to why the death rate in Germany is comparatively low. The first is that the experts say Germany is in the relatively early stages of the epidemic. Secondly, it has a well-resourced and rather robust health system. But thirdly, and perhaps crucially, it's about, the experts say, the way in which testing has been carried out here. The authorities have tested very widely and they've tested very quickly. That, in theory, means that people are being caught in the early stages of infection, and in theory it means that there are fewer undetected cases out there. And it's perhaps worth noting too that a lot of the people who've been tested and confirmed positive so far have been relatively young. Just having said all of that, they do expect that death rate to start to rise.
Well, nearby countries have recorded much higher death tolls. One example is Spain. In just 24 hours, the number of fatalities jumped from 200 up to 803. And that's the number of cases, 17,000 people across the country infected. The BBC's Guy Hedgecoe is in Madrid.
Here in the Madrid region, where we're seeing around 40% of all cases, and that obviously puts a tremendous amount of pressure on the local healthcare services. Now, the government has tried to take measures to alleviate that, not just here in Madrid, but elsewhere across the country, for example, by nationalising private hospitals. But it does seem to be a big problem here in Madrid in particular. Also, we have seen a number of outbreaks of the coronavirus in retirement homes. Now, elderly people are obviously a particularly high-risk group, so that could be contributing as well to that relatively high death rate. And in addition to that, there has been some criticism of Spain when it comes to its testing for coronavirus, that the testing hasn't been done soon enough, that it hasn't been rigorous enough, and therefore that when people are being hospitalised, that it's that much more difficult to cure them and indeed to save their lives.
The Tokyo 2020 Olympics is still in doubt, but in Greece, the Olympic flame was formally handed over to Japan. The ceremony was being held behind closed doors. Tokyo 2020 organisers insisting the Summer Games will go ahead. The torch arrives in Japan on Friday for a simplified relay that's scheduled to start in Fukushima. Well, this, of course, is an economic crisis too. We've had a big development from the European Central Bank. Let's take a look. It's pledged $820 billion package to ease the impact. The ECB boss, Christine Lagarde, has been tweeting, "Extraordinary times require extraordinary action. There are no limits to our commitment to the euro. We are determined to use the full potential of our tools within our mandate." For the first time, China has reported no new homegrown cases of the coronavirus, a rare bit of good news, I suppose. Now, that includes Wuhan, the city where the outbreak began, which has been on lockdown for nearly 2 months. The quarantine rules have been slightly relaxed in Wuhan. It is still designated a high-risk area, but people are now being allowed to walk around their compounds and exercise outdoors. Chinese media claiming if no new cases are reported for 14 consecutive days, the restrictions could be reduced further. Well, Singapore and South Korea, let's head over there because they're both having some success battling the virus at home. Singapore reported 47 new cases, of which 33 were actually imported. And South Korea has recently been able to limit the outbreak there, but has had a sudden jump in new cases, 152, with 74 of those coming from a nursing home in Daegu. Japan has only reported 3 new cases. Hokkaido is the worst affected Japanese region, but is now lifting its state of emergency, which has been in place since late February. Now, given the recent success, a growing concern in Asia is people bringing the virus back from abroad. Despite having no new cases domestically, China did record 34 new infections among people coming into the country from abroad. As Stephen McDonald now reports.
34 new cases. Most of those are in Beijing, in fact, and a lot of these are Chinese people returning home from North America and Europe, believing that this is the safe place to be. And for that reason, the Beijing government even issued a sort of statement saying that all these Chinese students studying overseas, unless you have a good reason to, you shouldn't come back. So they're already trying to tell people they don't want them flooding back into the country because everything's kind of under control now. And imagine there have been cases of people with coronavirus symptoms who've boarded planes, they've taken drugs to suppress the conditions, so it seems like they're all right. They arrive in Beijing, somebody gives them a proper test, and they have the coronavirus. Now imagine that, again, you could be infecting everybody on that flight, you're in a crowded airport, more infections, and that's why in big Chinese cities there are still these very strict quarantine rules.
Iran has reported its biggest jump in coronavirus deaths. 149 new fatalities have been confirmed in the past 24 hours. The death toll is now nearly 1,300, and there have been more than 18,000 confirmed cases. It's the worst affected country in the Middle East. And on top of that, experts believe the number of cases may be underreported because testing is being restricted to severe cases. Here's Rana Rampur from BBC Persian.
Iran is a very vast country and with more than 80 million people, and reports from many cities and smaller towns say that they don't have test kits and they're unable to test all the people who are passing away. But interestingly, Kianush Jahanpour, one of the spokespeople for the health ministry, said that every hour 50 Iranians are being infected by the coronavirus, and every 10 minutes one person is dying. This is already a very high number, and if we believe these numbers are true, it seems that the measures that the Iranian authorities have introduced are not enough.
So here's the situation in the Middle East. These are the 5 most affected countries in the region. Israel, nearly 530 cases, and the government there says it will impose a curfew for the next 7 days. Qatar, over 450 cases. Bahrain, 1 death and nearly 280 cases. And Saudi Arabia has almost 240 cases. But Iran is the epicenter of the region's outbreak. The government's been criticised for responding too slowly. Even so, this week, it closed Shia Muslim shrines in Qom. And take a look at this, though. You can see people still went outside the shrines to pray. Well, in the US, there are more than 11,000 confirmed cases of coronavirus and more than 150 people have died. Washington state is the worst affected with 68 deaths. President Trump has asked US health regulators to roll out potential therapies aimed at treating the virus.
Clinical trials are already underway for many new therapies, and we're working on scaling these to allow many more Americans to access different drugs that have shown really good promise. We've had some really good promise.
President Trump named 2 drugs that the Food and Drug Administration, the FDA, is currently looking at. The first is remdesivir. It's an experimental antiviral drug. It's produced by Gilead Sciences, whose headquarters are in California. And this man is the company's boss, Daniel O'Day. He was at the White House earlier this month, meeting with the president and the task force there. Now, the second drug is a common anti-malarial called hydroxychloroquine. Here's the FDA chief.
We need to make sure that the sea of new treatments will get the right drug to the right patient at the right dosage at the right time. As an example, we may have the right drug, but it may not be in the appropriate dosage form right now, and that may do more harm than good. Those are the things that's our job to look at, and that's why it's really important we have these dedicated professionals looking at these aspects.